Hello, my name is Dr. Stanley Lang. Welcome to this video, and this is the first in a series of videos on the subject of Lyme disease. And in this series I'm going to review what it is, what it can be mistaken for, other conditions that can look like chronic Lyme disease, what can be done naturally, and some of the other options to treat medically if you want to use medication. So the first thing is, what is Lyme disease? And it's an infection by a germ. I'm not going to give the long scientific name, but it is a germ that is very unusual, and it is what we call a spirochete, which means that it looks like a corkscrew under the microscope. But the Lyme disease organism is unique in some ways because it can change its shape inside the body. It can become what we call a persister cell, which means it's somewhat globular in its shape under the microscope, which means that it can hang out in the body in a way that is difficult for the immune system to find it. So that's one of the reasons that Lyme disease can become a long-term infection in some people. So it starts out as this corkscrew kind of looking bacteria, but then it becomes, when it's being attacked, it can become this persister cell, and so it can hide more easily in the body. And in future videos I'll explain a little bit more how that whole thing happens. Now, how long has Lyme disease been around? Well, it was only talked about in the medical literature around 1980. There's a little bit of confusion about exactly when it was talked about, because in Europe it was talked about before it was talked about here. The versions of Lyme disease are different in Europe than they are in the United States, and that's because there's some slight genetic differences between the bacteria. But suffice it to say that the modern version of Lyme disease starts around 1980 or so. But there is genetic evidence that it's gone back many thousands of years in Europe and many hundreds of years in the United States. And so we know this by looking at the remains of humans that have been buried before, and there's genetic evidence for this germ in those people. So what happened between thousands of years ago, hundreds of years ago, and even in the early, let's say, 20th century, where Lyme disease wasn't a condition that was recognized? In other words, people were infected with this bacteria, but they didn't get sick from it. So what happened around 1980? Well, that's part of the big mystery, and one of the things I'll be talking about is why this organism has changed and what we need to do about it if we want to be able to overcome the infection, so to speak. So there's a big difference between being infected with something, which usually implies that the bacteria or the virus is doing damage to our tissue, versus being colonized by the bacteria. So what it looks like is that in ages past, this bacteria has been around and was living in people, but not causing disease. And I won't get in all the details of what it was doing, but some of it was actually helpful to people. And in parts of the world, like in the middle of Europe area, there were some changes in the physical body, in the joints, but they didn't cause any symptoms. So this is all fascinating stuff, but the point is something changed around 1980, and it became what we call a pathogen. It actually causes significant disease, and lots of people have these symptoms. The most significant symptom that people have in the early stages of Lyme disease is some sort of arthritis. So that's what Lyme disease is generally known for. But the longer the Lyme infection persists, it can infect any tissue in the body. It likes to infect neurological tissue. It can infect the heart even, and people have died from heart damage from Lyme disease. So this has been well recognized from years ago, so this isn't new knowledge. So the basic take-home message is that Lyme disease is a relatively recent disease, but not a recent situation where the bacteria was in our bodies. It's been in our bodies for hundreds and thousands of years based on the DNA evidence from ancient human remains. So something changed around 1980, and in the next video I'm going to talk about what we can do to understand the difference between acute Lyme disease and chronic Lyme disease. So at the end of this video you can click on that link to see the next video in the series, and I wish you well, God bless, and have a good day.